So if I ask you the 1 mark comment, yes, that blood vessel becomes stiffer in chronic hypertension, then how will you explain? Ready? Or large stiffness in large blood vessel is a hallmark of chronic hypertension. Stiffness in a large blood vessel is a hallmark of chronic hypertension. So now we are talking about vascular remodeling, okay, in response to chronic changes in blood flow and blood pressure. Okay, so we will cover the comment in process. So just be with me. So suppose your blood pressure is increased. Now see this figure, okay, and this figure, okay. We will also again come to this figure. Fine. We will scroll down so you can see the text. It will help you to understand my pronunciation. So suppose focus here that you have a rise in the blood pressure for a long time. So what is happening? Increase wall stress, mechanical wall stress, both in small and large. Ready? But the wall of a large blood vessel are made such a way because they have high number of muscles. Ready? So they are not constricting, but small vessel are constricting. Why they are constricting? To manage the tension, okay? According to Laplace equation, if you want to manage the tension, ready? So when pressure increases, the radius will decrease to manage the tension inside wall. So they will reduce their diameter. Okay. So in small vessel, look what is happening because of chronic pressure. Ready? The lumen is becoming narrow because of contraction of smooth muscle cells here. Fine. Very good. Okay. But there is no change in a wall thickness. Okay. But when large vessels are, now the hypertension comment is coming, right? The stiffer blood vessel is a hallmark of chronic hypertension. So when these large blood vessels are feeling the shear stress because of increased BP, what is happening? Their muscle cells are getting stimulated and they are increasing in size. They are becoming hypertrophic. Okay, they are increasing in size, becoming hypertrophic, and also there is an additional, okay, laying down of additional extracellular matrix protein. Ready? Such as collagen and fibronectin. So this is what is happening by increasing the size of a muscle cell and laying extracellular matrix protein. They are reinforcing the strength of the vascular wall to challenge this high pressure inside. Okay, so that's how in chronic hypertension the wall of large vessels become stiff. So in this figure you are seeing the large vessel, okay, their wall thickness is increasing because of extra muscle as well as additional extracellular protein like collagen and fibronectin. Okay, ready? Fine. The thickness of wall is here increasing. Ready? And because it is becoming stiff. Now another case, okay, another case is outward remodeling and outward hypertrophic remodeling. Look, what is happening here is in radial artery when you are making an arterial venous fistula. Okay, when we are making arterial venous fistula in a dialysis case, we want a easy access to artery. So what we do? So this is a picture of arteriovenous fistula. Okay, we do in a dialysis patient. Dialysis किसमें करते हैं? जिनका किडनी फेल हो गया है. So to purify the blood, we are doing this dialysis. Okay, but every time हमको एसेस करना है, हम क्या करते हैं? पूरा ब्लड निकाल के उसको क्लीन करते हैं. ठीक है. So this is a very painful and process. So artery can be damaged if you every time you poke catheter into artery. So what we do to poke this catheter, we choose saphenous vein. So here the blood goes outside, from here it goes inside, and there is a arteriovenous graft in between. Okay, so there is a fast flow of blood from here to here. Okay, so what happens? Radial artery is just feeling the increased flow of blood during dialysis due to this fistula. But this vein is actually feeling increased blood flow as well as increasing in pressure. Okay. So here we come to the point that this is the example of radial artery. Radial artery during this fistula is only feeling the elevated flow. So the lumen only gets bigger, no increase in a muscle size. Okay, so this is called outward remodeling. But the saphenous vein, sorry, not the saphenous vein, but the brachiocephalic vein is feeling, this brachiocephalous vein is feeling pressure as well as the flow. Okay, अभी पूरा 5 लीटर ब्लड को प्योरीफाई करना है, so you can understand the flow will be. और ऐसा हम कैसे करते हैं, कई पेशेंट में तो वीक में 2-3 बार वो लोग डायलिसिस करते हैं. ठीक है, जब लास्ट स्टेज में किडनी फेलियर पहुंच जाता है तो. ओके, तो इसको बहुत वियर एंड टियर होता है ब्रैकियोसेफलिक वेन को. इंक्रीज फ्लो भी फील होता है, इंक्रीज ब्लड प्रेशर भी फील होता है. ठीक है, सो व्हाट हैपेंस, द ब्रैकियोसेफलिक वेन will go under outward hypertrophic remodeling. The lumen also gets bigger as well as the cell wall becomes thick because of increase in a muscle layer size and increase in a extracellular matrix. Matrix में बोले तो yes, collagen and fibronectin. Okay, just to increase. And the same thing, this outward remodeling है ना, hypertrophic remodeling happens in a saphenous vein also, where in a coronary artery bypass. So in coronary artery bypass, the coronary is blocked. So what we are doing, we are taking the saphenous vein from the leg and we are shooing it with corona and bypassing the block. है ना, the block is bypassed here in coronary. So ultimately from aorta to coronary direct blood flow. But this is a vein. Okay, so vein is feeling high pressure as well as high blood flow. So it will again go into outward remodeling.